Now, I know you've all had to do quite a bit of imagining this morning, but just bear with me here. Imagine your car breaks down in the absolute middle of nowhere. Now, trust me when I say this, there is medicine in this talk, but for the moment, let's imagine. So your car breaks down, and what do? You call a mechanic. And the mechanic proceeds to tell you over the phone, hold your phone near the engine so he can hear the noise. Right? Okay, that's a new one. He then proceeds to tell you, pop the hood and point your camera at it so he can see the engine. He then asks you to describe any distinct smell, say burning oil, burning rubber, something like that. And a couple of questions just like that follows, all of which you answer. He then proceeds to use all of that information and diagnoses the problem. He tells you exactly what he thinks is wrong with your car, and you're thinking to yourself, brilliant. But hold on a second. Would you actually, seriously trust his judgment? I mean, maybe he is brilliant. Maybe he's fixed 1,000 cars just like yours. But say your connection's laggy, right? So the entire time, the audio he's hearing, a laggy mess. And when you pointed your camera at the engine, effectively, all he saw was 10 pixels. Something like that. And I'm sorry, is that a car engine or the International Space Station? Because I cannot seem to make that distinction. But of course, let me remind you, you're stranded. You are in the middle of nowhere. So it's either you roll the dice with whatever he says, or you wait forever for a mechanic to get there. And besides, it's just your car, right? So if something goes wrong, it could be significantly worse. It could be significantly worse. It's horrible, but it could be significantly worse if I had already mentioned that. So here's a hypothetical for you, right? Say your car is now priceless. Say your car is invaluable, irreplaceable, one of one, and if you lose it, well, you lose it. Maybe you've caught on to the idea I'm trying to get at here, but what if it's your life we're talking about? That car is you, and the mechanic, that's your doctor. And in essence, we have what I would describe my topic, telemedicine, a field dedicated to using communication technologies to provide healthcare across larger distances. And that's exactly what I'm here to talk about, all of it, the good, the bad, and the ugly. Movie reference, if you didn't get it, that's completely fine. Now, before we get into anything, I think it's extremely worth examining the origin of this field. And for this seemingly modern field, that number is 1874. 1874 was the first recorded case of telemedicine, when we had a surgeon in Australia telegraph wound care instructions for a patient in the country. Or there's the 1900s, in which we had heart rhythms transmitted by telephone in the Netherlands, or the 1920s, in which we had radio consultation centers in Europe for patients on ships, remote areas, etc. The point is, the field is incredibly old. But is it as good as it is old? The good. Now, I can break the good of telemedicine down for you in really two grand promises. The first of which is accessibility. Take a look at this chart for me. The chart behind me depicts, in 2015, the proportion of a population with access to basic healthcare. For a rural population, that number was 44%. To just put that into perspective, right? If we assumed we were all part of a rural population, less than half of us would have access to basic healthcare. For an urban population, that number was 78%. And look, both these figures are quite depressing. But what's apparent is that there's not even a gap, actually, that's a whole canyon. And it's canyons like these that are absolutely horribly detrimental for a rural population. Why? Because their magnitude of health challenges just tend to exist at a higher level. But of course, it's not just rural populations we're talking about. This need for accessibility stretches really far beyond that. For instance, wild hypothetical here, maybe a bit too absurd for all of you here. Say there's I don't know, worldwide pandemic, lockdown, 3 years spent at home, this massive virus going around. Okay, look, it's been 5 years. Half a decade if you want to feel even older. I don't know why you would want to, but we all remember, I'm sure we all remember COVID-19, because this field sure does remember. COVID-19 was an absolutely critical time period for telemedicine. Why? Because remote healthcare, aka telemedicine, went from a mere measly option to a worldwide necessity. And the data perfectly reflects this. Here's another chart for you. This is data from a CDC report in the US, and found that the percentage of visits being through telemedicine was 15.4% in 2019 and 86.5% in 2021. That's almost a 6 times multiple. And in this very same time period, we saw plenty, and I mean plenty, of investments into this field, and the formation of just really a large amount of platforms and services. For instance, if you were in Dubai during this time, you may recall, or may not, a platform or service known as Doctor for Every Citizen. It was launched by the Dubai Health Authority in December 2019, and basically any and all residents of Dubai could access free healthcare or free consultation 24/7 online. Well, that's just promise one. Promise two is convenience. Look, in a world in which we have seemingly such little time, convenience is arguably invaluable. And I'm afraid the words convenient hospital visits are words I've yet to hear anybody on this planet utter. I mean, let's just think about your last hospital visit, shall we? So, tell me, how much of that time was spent in medicine? Right, there's the traffic, the parking, the 45 minutes spent in a waiting room for effectively 10 minutes with your doctor. It's not uncommon for people to take the entire day off from work or school. Now, whether you want to take the day off from work or school is another story entirely. I can understand. But regardless, time is time. Telemedicine can be the difference between missing work for a 10-minute follow-up or doing it on your lunch break. I mean, really, just imagine dragging yourself through a clinic. Again, dragging yourself through the parking, through the traffic, through the 45 minutes just to hear, yeah, your x-ray looks perfectly fine. I mean, it's good news, don't get me wrong, it's good news. But good news can come in the form of a 2-minute phone call. And if it's serious, they can call you in. However, it's not just time that people save, it's money. Think about it. No loss of money from cost of commuting, or no loss of income from missing work. I mean, take a look at these numbers behind me. This is data from the results of a 2023 study in the US, looking at non-elderly patients with cancer. And it depicted that the average patient saved from $147 to $186 per visit. And I think it's worth emphasizing, per visit. That's a lot of good I've talked about. Let's flip that discussion. The bad. Look, telemedicine's greatest strength, distance, is also its fatal flaw. Let's rewind the classic doctor's visit, shall we? You walk in, you share some small talk, you're asked some questions about your past, your condition, and etc. And after all of that, we have the coveted physical examination. You know, that cold stethoscope to your heart and lungs, those reflex taps, the does it hurt here pokes, and sometimes they poke so aggressively that it hurts even if you're not ill. Those pokes, that physical examination, exactly. Now, unless your physician can palpate through a screen and has the force, I'm afraid I think it's reasonable to assume that we've largely lost the physical examination. And that can be critical, absolutely critical, in the most complicated of cases. Here's an infamous case study from the COVID-19 era. The case study title, of course, is up behind me, in case you're interested in the details. But essentially, there was a 71-year-old patient who had their skin abscess go completely under the radar from the lack of a thorough skin exam. That patient returned back to the hospital in septic shock, and unfortunately, she passed the very next day. Look, it's hard to tell how outcomes can change had that been discovered, but what's undeniable is that it was missed. However, I'd be lying to all of you if I said that zero physical exam can happen remotely. I mean, there are patient-guided exams, there are virtual tools at your physician's disposal, and in fact, there are plenty of studies looking at that concordance rate, or essentially similarity rate of diagnoses after an in-person physical against a virtual physical. For instance, here's one by the Mayo Clinic. It depicted an overall concordance rate, again, similarity rate, of 86.9%. And the highest was 96% in psychiatry, and the lowest being 77.3% in that field. I will spare you guys my attempt at trying to pronounce that, but 77.3% in that field. So look, it's apparent, it's extremely apparent that we see similarity in diagnoses between an in-person and virtual physical, but what's even more apparent is that there's a variance, a significant variance in the compatibility of specialties to telemedicine. And it all comes back down to the limitations of a virtual appointment. I mean, it's simply harder for you, the physician, to access the information you require with the accuracy you need. I mean, just think about all the things a physician would have to depend on. What? They're depending on how well can the patient assist them, or their digital literacy. They're depending on how good is their connection and device, and they're even depending on how good is their lighting. For reference, I'm standing up here with a significant amount of light on me, but all it takes is for me to walk off stage and I can, how do I say this, completely change my skin color and become my dermatologist's worst nightmare, if that helps make my point. However, if we put this all aside for a moment and think about a fundamental idea that goes beyond or beneath all these layers of discussion we've just had, let's assume for just a moment that technology is perfect. Everything's great. Technology can perfectly replicate those in-person capabilities. Tell me then, would it still feel like medicine? No, seriously, would it still feel like medicine? It's convenient, yes, but we're trading that cold stethoscope, that cold stethoscope, for an even colder screen. It's convenience at the cost of connection, human connection. And really, I'm dubious of how much of that connection you can get when your doctor is a mere collection of pixels. Of course, it's not all black and white, right? Not every specialty is well compatible with telemedicine, and not every patient has to go completely virtual. Some will always just better benefit from that in-person visit. And in fact, for certain forms of testing, I think it's reasonable for me to say you just have to make that commute, right? I think it's reasonable for me to say that we all, or most of us, have a thermometer at home, maybe even a blood pressure cuff. But unfortunately, what I've yet to see is anybody own a $5 million MRI machine in anyone's living room. And if anyone does, I'd love to have a chat after this talk. I mean, really. Okay, look, telemedicine can be an option. It is an option. But it's also a lifeline for those who cannot easily access healthcare. And you may remember from the beginning, that was rural communities, right? Actually, let me just jog your memory, right? Here's that same chart again from the beginning. It's important you see that again, because now we're about to get in to the ugly. So looking at this chart, it's apparent, I think we can all agree, that rural communities need greater access to healthcare. But here's the reality of things. Now, I've showed you maybe an absurd amount of charts today, but I just need you to look at one more for me. The chart behind me depicts, during COVID, in the US, the percentage of health centers that had more than 30% of their visits being through telemedicine. Now, I know that's a bit of a convoluted statistic, I get it, but really what that's looking at is the implementation and usage of telemedicine. Keeping that in mind, do you notice something that's oddly peculiar about this? Something similar to the previous chart? Here's that previous chart again for you. Here's that previous chart for you. Accessibility, and now implementation and usage of telemedicine. Tell me why. Tell me why these charts look so similar. Tell me why rural communities are put behind again. And believe me, this is not something that's just specific to America. We see this pattern across borders. So why? Follow the money. Look, it's not profitable. It's expensive. It's not profitable for a hospital to implement and use telemedicine in any sort of rural community. I mean, you're instilling a ridiculous amount of infrastructure, including a consistent broadband connection, or really any medical technology that's required to make a telemedicine visit effective. So what ends up happening is that communities that are the most deprived of healthcare are deprived of the very tool that can help them. Tell me, what is the point of only deploying life-saving technology where it's profitable? Money is really where this field gets ugly, and admittedly, in the time I have, I can only scratch the surface. So, where does this leave us? Well, telemedicine can be good. It can be convenient, breaking borders and slashing costs. It can be bad when the human connection of healing comes into question, and it gets ugly when profit and money controls the narrative. And the future, well, it's always hard to predict what the future of such a field will look like in, say, 5 years, let alone 1. I mean, in this talk, I joked about a doctor palpating through a screen. This type of tech already exists, albeit with a significant amount of limitations. But my point is, imagine what could transpire in just a few years. Or what about artificial intelligence? Now, looking at all of your faces, I think it's apparent nobody is surprised I'm bringing up AI. I mean, it's practically every topic now that we're waiting for the bit about AI to come up. I get it. I know. Still, in this talk, I criticize how human medicine is when your doctor is a mere collection of pixels, a screen. But that discussion, that debate may very well turn into a discussion about your doctor turning from a screen to mere AI chatbot. Look, I really do hope that telemedicine will become a vehicle for medical accessibility, an engine for universal healthcare. But at the very same time, I hope we don't lose sight of how human medicine should be. And maybe then, there may exist a future, a day in which no patient gets left on the roadside, and every human doctor or mechanic has the right tools to help. Thank you. That's all I have for you.